Good morning, everyone. Today, we will explore effective communication in sexual and reproductive health, or SRH, with a focus on integrated marketing communication, or IMC, and key communication theories. We'll discuss how well-coordinated communication strategies help improve awareness, trust, and the adoption of SRH services across diverse populations. To start, let's examine the role of IMC in healthcare and why it's critical for effective messaging. Integrated Marketing Communication, or IMC, is a strategy that ensures all communication efforts are coordinated to deliver a consistent message to the audience. Connects diverse patient populations. IMC allows healthcare providers to communicate effectively with different groups, including adolescents, rural communities, men, and marginalized populations, ensuring that no one is left out. Integrates advertising, PR, digital, and interpersonal channels. By combining multiple channels, IMC ensures patients hear the same message whether they encounter it on social media, in a clinic, or through community health workers. Ensures consistent messaging across platforms. A patient should receive the same accurate and reliable information at a clinic, via SMS reminders, and in community outreach programs. Enhances brand consistency and operational efficiency. Coordinated messaging reduces confusion, reinforces credibility, and helps organizations use resources efficiently. Now that we understand its role, let's see how IMC applies specifically in the SRH context. In SRH, IMC ensures that all communication activities, whether advertising, personal selling, public relations, or digital campaigns, work together to deliver a unified message. Coordination of promotional activities. This includes media campaigns, direct mail, personal selling, PR, and digital marketing, ensuring that every touchpoint conveys consistent information. Produces a unified, patient-focused message. Patients receive the same message across all channels, reinforcing trust and understanding. Strengthens brand image across channels. Consistency helps SRH programs or clinics become recognizable and reliable, increasing patient confidence in services like contraceptives, HIV prevention, or fertility care. This coordinated approach has practical implications for how SRH messages are delivered and perceived by different communities. IMC in SRH is particularly important for conveying messages about service quality, safety, and patient rights. Consistent messaging on safety, efficacy, and service value. Every message reinforces the reliability of services. For example, advertising a new contraceptive must highlight its safety and proper usage, and counseling sessions should repeat these points. Supports patient rights and reduces misinformation. Clear, consistent communication combats myths, such as misconceptions about contraceptive side effects or STI testing procedures. Reaches underserved groups. Youth, men, migrants, and LGBTQ+ populations may face barriers accessing information. IMC ensures they are reached through culturally sensitive, accessible channels. Now, let's discuss why IMC matters and the benefits it brings to SRH programs. IMC is critical because SRH programs communicate with multiple audiences, each with unique needs. Communicates with multiple audiences. Patients, donors, policymakers, and community leaders all receive tailored messages that are aligned and consistent. Aligns promotional, clinical, and health literacy messaging. Every message reinforces key messages to improve understanding and action. Improves service adoption, trust, and behavior change. Coordinated messaging encourages patients to use services correctly, follow treatment plans, and adopt healthy behaviors. An integrated approach not only improves impact, but also enhances efficiency and patient engagement. By integrating communication channels, IMC improves operational efficiency and strengthens the patient experience. Improves efficiency and cost-effectiveness. Coordinated campaigns reduce duplication of effort and maximize resources. multi-channel campaigns reinforce each other. For example, a digital campaign can support in-person community outreach, ensuring patients receive consistent messaging repeatedly. Ensures consistent patient experience. Patients experience the same quality of information whether through apps, websites, or health workers, building trust and confidence. Digital tools are now central to IMC, expanding access and engagement even further. Digital communication is essential in SRH because it combines convenience, privacy, and reach. Mobile apps, telehealth, and social media enable patients to access information and services discreetly. For example, a teen can learn about contraception safely via an app without stigma. Connects physical services with online touchpoints. Patients can book appointments, access counseling, and receive reminders digitally, bridging the gap between in-person and virtual care. Enhances reach, retention, and engagement. Online platforms allow ongoing communication, increasing adherence to treatment or follow-up schedules. Despite these advantages, implementing IMC in SRH comes with challenges. Effective IMC requires careful coordination and management to overcome several challenges. Maintaining message consistency across channels, ensuring that digital campaigns, community outreach, and clinic messaging are aligned, coordinating diverse stakeholders, governments, NGOs, and private partners may have different priorities. Managing cultural sensitivity. Messages must respect local norms and beliefs to be accepted. Ensuring data privacy. Patient information must be protected in all communication channels. Allocation of time and resources. Coordinated campaigns require planning, monitoring, and adequate resources. To better understand how innovations are adopted in SRH, we turn to the diffusion of innovations theory. The diffusion of innovations theory explains how new ideas, practices, or technologies spread over time within a social system. Key elements: innovation, e.g. a new contraceptive, communication channels, time, and social system. SRH innovations. Examples include new contraceptives, PrEP for HIV prevention, self-testing kits, and digital health apps. IMC strategies can support each stage of adoption to improve uptake of SRH innovations. IMC can guide patients through the 5 stages of adoption: knowledge, persuasion, decision, implementation, and confirmation. Knowledge. Patients learn about the innovation through coordinated campaigns. Persuasion. Messaging highlights benefits, addresses concerns, and builds trust. Decision. Patients are encouraged to try the service or product. Implementation. Support is provided to use the innovation correctly. Confirmation. Reinforcement ensures continued use and satisfaction. Segmentation by adopter type. Innovators, early adopters, early majority, late majority, and laggards. IMC messages are tailored to each group. In SRH, diffusion theory helps overcome barriers like stigma and misinformation. Applying diffusion theory in SRH allows targeted strategies for different populations, overcomes stigma and cultural resistance. Example, using trusted counselors to promote long-acting reversible contraceptives, or LARCs. Identifies opinion leaders. Influencers or community leaders can accelerate adoption. Tailor messaging by adopter category. Early adopters may prefer digital campaigns, while later adopters may respond better to interpersonal counseling. Another theory that complements IMC is relationship marketing, which focuses on long-term patient engagement. Relationship marketing prioritizes building long-term relationships with patients over one-time transactions. Key concepts: trust, commitment, reciprocity, and shared values. SRH Application ensures patients remain engaged across the continuum of care, from counseling to follow-up services. Relationship marketing builds trust and loyalty through consistent patient-centered communication. Personalized communication and empathy. Patients feel understood and valued, which encourages continued engagement. Feedback loops. Patients provide input, which improves services and messaging. patient retention, and advocacy. Satisfied patients may encourage others to adopt services, amplifying impact. Now let's see how IMC and relationship marketing complement each other. When combined, IMC and relationship marketing create a powerful communication strategy. IMC ensures consistent, clear messaging and reinforces brand identity. Relationship marketing builds trust, personal connection, and long-term engagement. Benefits: messages are amplified, resources are used efficiently, and patients develop loyalty and confidence in services. Integrating both approaches provides a holistic framework for SRH communication. A holistic approach covers all patient touchpoints. IMC informs, educates, and persuades patients about services. Relationship marketing builds loyalty, trust, and advocacy. Outcome: improved patient satisfaction, retention, adherence, and overall health outcomes. Here's a practical example to illustrate this integration. Consider the launch of a self-injectable contraceptive. Diffusion. Target early adopters using digital campaigns, influencer promotion, and informative content. Relationship marketing. Provide ongoing support via peer networks, WhatsApp groups, and telecounseling. IMC. Ensure all messaging across clinics, pharmacies, social media, and apps is consistent, reinforcing safety and correct use. Finally, let's look at how the communication mix can maximize impact. Strategic use of the communication mix enhances reach, engagement, and effectiveness. PR plus digital. Conduct stigma reduction campaigns combining community events with online messaging. Personal selling plus digital. Counselors provide personalized advice supported by digital reminders and follow-ups. Advertising plus education. Normalize SRH topics and improve health literacy through informative campaigns. Sales promotions. Expand ethical access while educating patients about services and products. In conclusion, IMC, combined with communication theories like diffusion of innovations and relationship marketing, ensures consistent, trustworthy, and patient-centered messaging. This approach improves service adoption, patient engagement, and ultimately health outcomes in sexual and reproductive health.